If you are one of the 61 million Americans with a disability, you likely have a story about the time or times you had trouble getting the medical care you need. And a new study is giving troubling insight into at least some of the reasons, with many physicians indicating a bias against caring for people with disabilities, sometimes even going so far as to discharge them from practices. I'm joined by two of the authors of the study, Dr. Lisa Iezzoni, who is also a professor at Harvard Medical School and a longtime researcher at MGH's Mongan Institute, and Dr. Tara Lagu, director of Northwestern University Center for Health Services and Outcomes Research. I have to say, doctors, for anyone who has had a disability or a family member who's had a disability and had to get two doctor's appointments, this study sort of illuminates and verifies and affirms the experiences that many of us had. Before we get into talking about it, I want to show one stat here about the findings, the survey of more than 700 physicians that was published in January. And the startling statistics here, 36% reported knowing little or nothing about ADA legal responsibilities, 71% answered incorrectly about who determines reasonable accommodations, and 68% felt at risk for ADA lawsuits. Dr. Iezzoni, I want to start with you first. Can you tell me how this survey was done and how you got the additional information from the respondents?
Conducted the survey in 2019 to 2020, so late 2019 through early 2020. The focus groups that Dr. Lagu actually reported on were focus groups that we had done to prepare the survey, to make sure that we would ask the right kind of questions to the doctors to get answers that would be meaningful about their experiences with and perceptions of caring for people with disabilities. And the survey was a random sample of physicians from 7 specialties nationwide.
And Dr. Lagu, what prompted the release of the deeper dive into this information? I mean, we see these statistics, we read them, we think that's terrible. I hope something changes. But when you look at the responses, which we're going to get into more, it's shocking.
It is shocking, and honestly, we reported on the survey because it was really hard hitting and informative. And then as we went back and thought about these focus groups that had informed the survey questions, we realized that there was a lot of content there that we couldn't ask about in the survey that was revealing and in some ways explained why physicians were making some of the comments in the survey they were making, like that they didn't welcome people with disabilities to their practice. And so when we went back and looked at those transcripts, and there were doctors saying, you know, I feel overwhelmed. I feel like there are too many barriers. I can't care for patients with disabilities. And then in the light of this feeling of overwhelm, we're making some terrible choices that had impacts for these patients. So we just felt we had to write it up.
Let's take another look. The response given in one of the physician focus groups that you're talking about published, this person talking about accommodation. We've gotten to a point in society where a lot of people are wanting some form of accommodation and a lot are illegitimate. They want their pet peacock on the airplanes and whatnot, and that makes it very difficult. You know, Dr. Iezzoni, I spend a lot of time, one of my family members has a disability and had a very difficult to diagnose number of chronic illnesses. And at every given moment that someone would say, well, you have to prove this, you have to prove that, the barriers to getting care or getting accommodations seem to be overwhelming at some point. And then to find out that one of the reasons that may have been, you know, maybe because the physician, he or herself, may actually have a bias thinking that everyone is just asking for accommodations. How do we address that?
I think it's going to be tough because it's basically a societal issue. I mean, the situation with the pet peacocks, you know, really trivializes what the real issues are. And so I think, as Tara says in the paper, that education is needed, training is needed. But the problem from my point of view is that we don't have time to wait. You know, it takes about 7 years to produce an internist, and we don't have time to wait for that to happen because we have growing numbers of people with disability in the country. And so I think that we just need more awareness, like the kind of study that we're doing to get this information out there.
I want to look at these next two answers too, which and talk a little bit about the ADA and lawsuits, which I know isn't necessarily in your realm. Another response from the focus group: a lot of us, me personally, are afraid to treat people with disabilities. You just don't want to deal with them, and that's what the ADA is all about. And then another response: a big problem is not knowing myself what would be the best kind of care, the best equipment for them. I don't even know. I'm not even qualified. Dr. Lagu, I've seen a number of reports, some anecdotal, of people being concerned about ADA lawsuits, and then other people saying, well, if we don't sue, it doesn't change. It's not, going to court is not our number one point, but sometimes there's no teeth in the laws to actually get people to change. And Dr. Iezzoni is talking about education and how long it takes. Is that what has to happen? Do we have to get into the med schools, into the practices, and say, these are the challenges, this is the reality of the ADA, and this is the reality of the patients you have to treat?
So some of it is education, some of it is policy for sure. If we think about how policy works, you know, payers like Medicare and others set the prices for what doctors make, and doctors feel pinched in a lot of situations. And as a result, adding additional work like providing accommodations for people with disabilities is part of the reason that they responded the way they did. It's inexcusable and likely discriminatory. And for that reason, we can't allow it to go on. But the why behind the whole answers to those questions was that we have big system problems in how we deliver care. And the frustration that physicians in these groups were expressing suggests that it's not just people with disabilities. The problem is the way they describe that they deal with their frustration is that they just find ways to deny care to people with disabilities. And the ones that you described were some of them. Others said things like, I don't take your insurance, or you don't have a problem that needs this kind of treatment, or you need specialized care and I'm not the doctor for you. And of course, what's tricky about this is that anyone can call a doctor and ask for an appointment and be denied care because physicians have discretion in who they take as patients. It's just that you can't be discriminatory when you exercise that discretion. And it's pretty clear, although we don't know for sure, because we don't know if these physicians take the patient's insurance, that there's likely some discriminatory discretion happening here. And so really, this is about change on every level. I think it's education, it's culture, it's training, it's reimbursement. It's how do we prepare health systems to care for people with disabilities? How do we let doctors know that people with disabilities are coming and have the accessible equipment in the office, the staff trained, everything available for that patient? And I think there's huge system problems that underlie this. The problem is that faced with those huge problems, some doctors in our study made the right choice, which is to not discriminate, and some clearly made the wrong choice. And that's the big problem.
Yeah, Dr. Iezzoni, it's from my experience, and I'm certain it's not typical, but from my experience, the numbers of doctors that I deal with for my family member are 7. And the 7 are all in the same healthcare with excellent healthcare. You know, I'm not complaining about our privilege of the access that we have, but they rarely talk to each other, and rarely, you know, before my family member gets to the appointment, they read the report, and then, you know, we've got whatever time is left, and then they'll say something like, you need to do X. Well, the patient can't do X because of this illness they have from Dr. A. So Dr. A can tell you why they can't do X, but that requires the patient who also has a mental health challenge to be able to answer that question. And so to this point of the barriers, even if you get in, it seems that the doctors often, and again, not necessarily out of ill will, but just are unable to treat the whole patient. And if Dr. Lagu is right, which I expect that it is correct, how do we start fixing this system so that we are delivering the health care that I'm sure doctors mostly want to deliver to the patients?
Well, Dr. Lagu was absolutely right that it's policy as well. Payment is inevitably an issue in the US healthcare system. And what you're really talking about is coordination, integration of care. Um, it just often isn't paid for. And so this is not something that we specifically addressed in our study, but it is certainly something that we hear from healthcare providers and from patient advocacy groups all the time.
Dr. Lagu, what did you see some of the more egregious things that physicians did or didn't do when it came to treating patients with disabilities?
I mean, some of the attitudes that were expressed were inflammatory to the point where some of our research staff became tearful while they were reviewing the focus groups. I mean, there was a lot of very negative statements, implying that people with disabilities are not worthy of their care, are entitled. It was really inappropriate. And you kind of wonder how this person got to the point where they were saying this, because nobody goes to medical school because they want to discriminate against vulnerable patients. And you just sort of wonder what drove this person to say this kind of stuff in a focus group with other doctors run by a moderator who clearly cares about this issue. And so we were somewhat overwhelmed. And when it got to the point in the focus group where physicians were talking about discharging people from their practice, pretty angry as well. It was hard to deal with. I think the answer for me is that this reflects many of the frustrations and problems that doctors experience working in our healthcare system. This is one of the comments that was frequent was like, well, this is only a few of my patients. But in fact, it's not a few of your patients. It's all of your patients. Your patients are aging. Your patients are 9 months pregnant. Your patients who have a sprained ankle. Your patients who become hard of hearing in their old age. There are so many people who face these barriers and need accommodations. And even beyond that, so many of us have challenges accessing the healthcare system, even if we don't specifically need accommodations. Although care for disabilities is the focus of this paper, the bigger picture is that the healthcare system is broken for almost all of us, and we need answers.
Dr. Iezzoni, what's the response from the medical community been to this report and these focus groups?
This report is pretty new, and so we haven't yet heard much. However, we did have a report that came out in February of 2021 about what for me was one of the most impactful findings of the survey. And that was that 82% of doctors think that people with disability have worse quality of life than other people. Only 42% of physicians feel strongly confident that they can provide equal quality of care to people with disabilities. And only 56% of physicians strongly welcome people with disabilities to their practice. I began to hear from some physician and professional organizations that they were pretty shocked by these findings. And it was kind of committing them to an introspective course. They needed to kind of figure out whether their members of professional associations also felt this way. But I don't know how far that has gone.
Well, we will have to stay posted on that. I appreciate both of your joining us and the work that you've done on this issue, and look forward to reading more and learning more. Thank you, doctors. Thanks for joining us.
Thank you for having us.